the management of snake bite. So, snake bite, is a medical emergency that requires prompt and appropriate care to prevent serious complications or death. So, here is the detailed guide to manage snake bite. So, immediate first aid at the scene, stay calm, keep the patient still. So, this is very important because you have to reassure the patient to stay calm, and if you are the patient, then you should also stay calm because movement can increase the spread of venom, because further movement and panic nature will increase the heart rate and blood pressure, which further increase the distribution of the venom. Have the patient lie down with the bitten area immobilized and or slightly below the level of the heart. Remove any tight clothing or jewelry because after some time the bitten area may become swollen. So remove any rings, bracelets or tight clothing near the bitten site before swelling occurs. Do not cut, suck or apply ice. So as you know, this is very traditional method. So and we often hear in our clinical practice that cut at at the site of snake bite, or suck or apply ice at the site of snake bite, but do not cut the wound or try to suck the venom, as this can worsen the injury also and also introduce infection to the bitten site. Do not apply ice or tourniquet, this can further cause additional tissue damage, and immediately transport to a medical facility. Emergency management at the healthcare facility. Once you go to the healthcare facility, whether it is primary, secondary or tertiary, it should contain antivenom. So first you take history and the physical examination of the patient, gather information about the type of snake if known, time of bite and the symptoms, because different types of snakes are there and different types of bites are there. Neurotoxic bite is different, elapid bite is different. So neurotoxic bite will show the nervous system disorders, nervous system malfunctions. Elapid bite, some bite causes blood coagulation, which we will see further. So examine the bite site for the signs of envenomation, swelling, pain and erythema can be there, and see further systemic systems like nausea, vomiting, difficulty in breathing, muscle weakness or any. So, in vital signs, you monitor the blood pressure, pulse, respiratory rate, and oxygen saturation. You take the blood sample and send for the laboratory tests for prothrombin time, APTT, INR to assess for any coagulopathy, complete blood count to check for hemolysis or thrombocytopenia, renal function test to monitor for acute kidney injury, and electrolytes to assess for any metabolic disturbance. So, antivenom administration. So, indication of antivenom administration is different. Administer antivenom as soon as possible if there are signs of significant envenomation, such as progressive swelling is there, systemic symptoms or abnormal laboratory results are there. The dosing of antivenom is initially it ranges from 5 to 10 vials for mild envenomation and 10 to 20 vials for moderate to severe envenomation. So dilute the antivenom in 250 ml or 500 ml of normal saline or 5% dextrose and administer IV over 30 to 60 minutes. Continuously monitor for any signs of allergy, reaction to antivenom including anaphylaxis. Keep ready injection Avil, hydrocortisone and adrenaline. Be prepared to treat with epinephrine, antihistamines and corticosteroids if needed. Monitor the clinical response and consider additional doses if there is no improvement of symptoms. Symptomatic and supportive cares are pain management, administer analgesics like paracetamol or opioids, avoid NSAIDs due to risk of bleeding. You give tetanus injection to the patient. Wound care, clean the bitter wound and apply antiseptic and sterile dressing. Surgical debridement may be necessary for necrotic tissue. Administer IV fluids to maintain hydration and blood pressure. For the management of coagulopathy, if coagulopathy is present, and if present, it will show prolonged prothrombin time, APTT or elevated INR ratio. Consider administering fresh frozen plasma or cryoprecipitate. For respiratory support, if the patient exhibits signs of respiratory distress or paralysis, provide supplemental oxygen and be prepared for intubation and mechanical ventilation in case of any respiratory failure. You monitor for the complications. Compartment syndrome can be there. So in if the compartment syndrome is present, it will present with severe pain, swelling, decreased sensation, and if suspected, surgical fasciotomy may be indicated. In case of acute kidney injury, monitor the urine output and renal function, provide supportive care including dialysis if necessary. Then observation. Patient should be observed for at least 24 hours after the bite to monitor for delayed reactions or complications. Long-term follow-up includes monitoring for serum sicknesses. So serum sicknesses is a delayed allergic reaction to antivenom. It can occur after 5 to 24 days of the snake bite. Symptoms include fever, rash, joint pain, and swollen lymph nodes. Treat serum sickness with corticosteroids and antihistamines if needed. Physical therapy includes patients with significant tissue damage or those who underwent surgery or fasciotomy may benefit with physical therapy to regain function and strength. For psychological support, some patients may experience anxiety or post-traumatic stress disorder after a snake bite, so counseling or psychological support may be beneficial. So, and prevention tip is public education is there, like what I am doing right now. Educate the at-risk populations on avoiding snake bites, such as wearing protective clothing, using a flashlight when walking in snake-prone areas at night, avoiding provoking snakes. So, key point, antivenom is the definitive treatment for envenomation and should be administered as soon as possible after the snake bite. Supportive care is critical to manage complications and ensuring patient recovery. Observation and follow up are necessary to detect and treat delayed effects. So, prompt and appropriate management of snake bite is critical to reduce morbidity, mortality. The use of antivenom along with the comprehensive and supportive care significantly improves the outcomes. Snake bites can be categorized based on the type of snake involved and the nature of envenomation. So, understanding the type of snake bites helps in determining the appropriate treatment management. So, there are different type of snake bites. We will discuss it one by one. First is dry bites. So, dry bite occurs when a snake bites but does not inject any venom. So, no venom has been injected inside the body. This happens in about 20 to 50% cases of bites. The snake might not inject venom due to being a defensive bite or because it has depleted its venom supply. So the symptoms will be only pain or minor puncture wound at the site. Any systemic or severe local symptoms will be absent in this case, such as no swelling will be there, no bleeding will be there, or no neurological signs will be there. So management is only observation in a medical facility. Wound care and tetanus prophylaxis is necessary. Venomous bite is second. So venomous bite involves injection of venom which can cause local and systemic effects depending on the type of snake and venom. So type of venomous bites, the first one is neurotoxic bite. So neurotoxin is there in neurotoxic bite which affects the nervous system and hence neurotoxic. So common snakes with neurotoxins are cobras, karath, coral snakes, and sea snakes. The symptoms of neurotoxic bite will be related to nervous system symptoms. So muscle weakness will be there, paralysis, drooping of eyelids, difficulty in swallowing, slurred speech. Severe cases can lead to respiratory paralysis and death if untreated. Management of neurotoxic bite is antivenom specific to the snake bites or antivenom specific to neurotoxin. Supporting care, including respiratory support if necessary. Second bite is hepatotoxic bite. So, venom type is hemotoxic venom, which affects the blood and tissues. So, common snakes with hemotoxins include vipers, Russell's viper, saw-scaled viper, and pit vipers, also known as rattlesnakes. The symptoms will be local pain, swelling, bruising, and bleeding at the bitten site. Systemic effects include coagulopathy, and the patient will show increased prothrombin time, APTT, and INR ratio. Bleeding from the gums, nose, urine, or stool can be there. Hypotension and shock may develop in severe cases. Management is administration of antivenom specific to the neurotoxins or snake species. Management of bleeding and clotting abnormalities is done with fresh frozen plasma or other blood products. Monitoring and treatment of shock if necessary. The third one is cytotoxic bites. So venom type is cytotoxic venom causes direct damage to cells and tissues. Some cobras, puff adders are there with cytotoxins. The symptoms of cytotoxic venom include severe pain, swelling, blistering, tissue necrosis at the bite site. Compartment syndrome may develop due to severe swelling. In this case, fasciotomy can be done. Systemic symptoms are generally less pronounced but can occur in case of cytotoxic bite. So, management is antivenom administration, wound care, including possible surgical debridement in case of compartment syndrome, monitoring and treating for compartment syndrome if necessary. Non-venomous bite. So, not all the snakes are venomous, many of them are non-venomous. They are caused by snakes that do not produce venom or produce venom that is not harmful to the humans. Examples include boas, pythons, and most colubrids. Example is garter snakes and rat snakes. Symptoms is local pain, minor swelling will be there, superficial puncture wounds can be there. No systemic symptoms will be there, and innovation affects. Management is thorough wound cleaning and prevent infection. Tetanus prophylaxis must be there, and antibiotics if the wound is at the risk of infection. Now, complicated bites. So, some snake bites may lead to complication beyond the typical effects of venom. Example includes bites leading to compartment syndrome, secondary infection, or severe allergic reactions. So, complications. If compartment syndrome develops, so there will be increased pressure in the muscle compartments, can occur with severe swelling leading to tissue ischemia. If infection is there, it can be bacterial infection which can develop at the bite site, especially if the wound is not properly treated. Allergic reactions. Some individuals may have an allergic reaction to the venom or antivenom leading to anaphylaxis. So, general classification of the snake by type is Elapidae family like cobras, kareth, mambas, which contains neurotoxins. The symptoms are paralysis and respiratory failure, common symptoms, and management is specific antivenom and respiratory support. In case of Viperidae family bite, the snakes comes are vipers, pit vipers, and rattlesnakes. Viperidae family contains hemotoxins or cytotoxins. The symptoms are pain, swelling, bleeding, shock, tissue damage, or necrosis. Management includes specific antivenom, blood products, and wound care. Third one is Hydrophina family, which includes sea snakes. Venom type is neurotoxic or myotoxic, which affects the muscles. So, muscle pain can be there with paralysis, respiratory failure, and rhabdomyolysis. Management is specific antivenom, supportive care, and dialysis in severe cases. So here you can see at every type of snake bites, specific antivenom is there. So because of this, it is important you identify the snake or you take a picture of the snake. In India, the common antivenom contains antivenom for common kareth, cobra, Russell's viper, and saw scale viper. So the key points to take care is identification of the snake species is necessary, immediate medical attention should be there, preventive education should be given to all, especially who are living in the prone area. So the type of snake, different snake species produce different venoms and the appropriate antivenom, and those will depend on the specific snake responsible for the bite. Severity of envenomation ranges from no venom administration, mild to mild venom administration, moderate to severe venom administration, including local effects and systemic effects. Type of antivenom is different for different type of bites. So general guidelines for antivenom dosing is initial dose for mild envenomation 5 to 10 vials should be given. For moderate to severe envenomation 10 to 20 vials should be given in spite of the age or weight of the patient. This is very much important. For neurotoxic bite often requires initial dose of 10 vials, but the dose can be higher if there is evidence of neurotoxicity. For hemotoxic bites, the initial dose may be 10 to 20 vials depending upon the severity of coagulopathy or bleeding. How to administer? Antivenom should be diluted in 250 to 500 ml of normal saline or D5 and should be infused intravenously over 30 to 60 minutes. It is crucial to administer antivenom as soon as possible after the bite, ideally within a few hours. Additional doses are required depending upon the patient's response. If there is no improvement and if the symptoms worsen after the initial dose, you add further dose of 5 to 10 vials. Monitor the patient for clinical improvement and resolution of symptoms such as swelling, bleeding, or neurotoxicity. Coagulation test should be done, which includes PT, APTT, INR. Repeated doses may be needed until coagulation profile returns to normal. Specific consideration: children, the dose of antivenom in children is generally the same as in adults because of amount of venom injected by the snake is independent of the victim size. Allergic reactions can be there, so be prepared with epinephrine, antihistamines, and corticosteroids. Always observe the patient for at least 24 hours after any kind of snake bite. The correct antivenom must be used for the specific type of snake bite. In India, the common antivenom contains immunoglobulins against four types of snake bite, that is cobra, common kareth, Russell's viper, and saw-scaled viper. The dose is based on the severity of envenomation, not on the patient's age or weight. Continuous monitoring and follow-up of the doses are crucial for the successful treatment. Thank you.